Hi, this is Dr. Patel. I'm a interventional pain physician at the Deuk Spine Institute, doing this new procedures, not really new, but more innovative, novel procedures for the chronic knee pain called knee. All right, I'm just putting another needle. We're gonna do more deep numbing. Okay, we're gonna make small incision there, about 3 to 4 millimeters long. And the next thing we're gonna do is we're gonna use a cautery device with a guarded tip called Bowie. Picture. So right now I'm touching the bone where the picture the nerve is located, and I'm just gonna use the high temperature, high power cautery device to cauterize this nerve. Picture. Just taking pictures, making sure we are still in the correct location. Picture. 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 So I'm sweeping up and down and side to side to cauterize the nerve, and the goal is to obviously cauterize the nerve and cauterize the bigger section we can cauterize. Picture. So that way the nerve has no chance to regrow. You can do the same procedure with the regular standard thermal radiofrequency ablation, or some people do something called cool RF. The only issue with that is, as using X-ray machine and leaving the needle at the location where anatomically nerve is located, the issue is, as we cannot see the nerve with eye, there is a chances that you can miss the nerve and not cauterize, and that can fail that procedure. Also, the needle you use for that is about 10 millimeter tip, so you're not burning the big section of the nerve, so the nerve regrows very quickly and the pain can come back from within 3 to 6 months. With this procedure, there is no chance we can miss the nerve, as well as we're gonna cauterize the biggest section of the nerve, so chance of nerve to regrow is almost zero. Okay, we finish with the one nerve. We're gonna go second nerve, infromedial nerve. By the way, the patient is getting IV sedation by Dr. Bundes, who's expert in anesthesia. He's our anesthesiologist here. So patient is sound asleep, not feeling any pain, any discomfort at all. All right, we're going for the second nerve. Picture. 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 Alright, so we on the target, so we're gonna sweep the cartridge device anterior to posterior, top to bottom, and then side to side. Picture. 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 Okay. Alright, 2 nerves done. We're gonna go on outer side of the knee, go lateral side, the last nerve. I'm gonna go that side. Alright. More numbing. The last one. Picture. Picture. Alright. So again, we are in the middle of that bone on the outer side to get the last nerve on the outer side of the thigh. You can see I'm sweeping up and down, side to side. Picture. 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 Yeah, just putting the canalog in. So what we're putting is a little bit of cortisone steroid to help with any inflammation from this cauterization process. As it generates the inflammation because of the cauterization, inflammation of the bone called periosteum. Yeah. It's not gonna reach. The next thing we're gonna injecting is something called Exparel. It's a long-acting bupivacaine, marcaine. It's a numbing medicine. This is whole bar.
Yeah.
And that's the end of the procedure. Thank you very much.